Welcome to the College of Health and Human Services presentation. I want to give a sincere thank you to everyone for joining us tonight. My name is Jennifer Sawyer, and I am the Undergraduate Recruitment and Admissions Coordinator in the College of Health and Human Services, and I have two lovely colleagues in the room who will introduce themselves as well.
Oh, hello, everyone. I zoned out there for a second. I'm fine. Hi, I'm Chris O'Sullivan. I'm your contact in the Office of Admissions on campus. I'm the one who actually reads your applications and makes decisions, so I'm the one to impress. But yeah, if you have any general admissions questions, I'm here to help out with those.
Hi, everyone. My name is Maria Perez. I'm Academic Advisor in College of Health and Human Sorry, I can't even talk now. Health and Human Services. I've been doing this job for over 3 years now, and I do advise all majors in the College of Health and Human Services, so you may end up meeting with me. It's good to have you here. Welcome.
Thanks. So tonight I will spend a very, very quick 10 minutes giving an overview about our college, and at the end we will allow about 10 minutes for questions. As I am progressing through the slides, feel free to type your questions in the chat box, which is located in the lower right-hand side of your screen. And once again, at the conclusion of the presentation, we will go back and address your questions. So we will get started. So as a prospective student in the College of Health and Human Services, we do hope you will join us in enhancing and fulfilling our mission, vision, and core values. You can certainly read through those, but I will draw attention to our mission, which is to engage our diverse student body and faculty in transdisciplinary academics, research, and interprofessional practice to promote the health of populations while eliminating disparities. These are our undergraduate programs. I will go further in depth with all of these, but just to give you an overview, we do have global and community health, health administration and policy, social work, nursing, and coming soon we will have nutrition to add to our list of programs as well. We do have minors within the College of Health and Human Services. All of those are listed in the screen in front of you. If you do want to enhance your program, you can certainly choose to have a minor that we offer, but know that you are not required to have a minor at any point in time, but you can. And if you are interested in a minor outside of our college, you are certainly able to do that as well. We do have a couple of accelerated master's programs for you to consider. I know you guys are just starting out, but it never hurts to go ahead and look even further in advance. You can earn a master's degree quicker by streamlining the application process with no GRE requirement. It does give you the ability to take 6 credits of graduate courses as an undergrad that will double count towards the bachelor's degree and the master's degree. We have a Master's of Public Health, which is available to students in any undergraduate program, a Master of Science in Health Informatics, which is available only to students enrolled in the BS Health Administration program and the Health Informatics concentration, and then there is a Master of Social Work, which is available only to students in the Bachelor of Social Work program. So a little bit about our programs, starting with Community Health. This program prepares students with the basic knowledge of public health, the healthcare system, and issues and policies related to health promotion, disease prevention, and education. With this particular program, you can opt to have a concentration, and there are 3 options. You can do the standard program with no concentration. If you choose not to do a concentration, it actually has about 30 credits of elective, which makes it fairly flexible so that if you do want to include a minor or something like that, you certainly can. Or you can opt for one of the concentrations. The first one is Global Health, which focuses on improving health conditions in developing countries. And then we also have a Clinical Science concentration. With this concentration, it actually wipes out those 30 credits of electives that I was just mentioning and puts a lot of science coursework. And it does prepare you to go on to some sort of pre-professional medical program, whether that's pre-med, pre-vet, pre-dental, pre-pharm, pre-dental, I think I already said that, pre-PT, pre-OT, pre-PA, whatever it is. Any sort of medical program, it will prepare you to go into your medical school of choice. So a lot of students seem to think that biology is their only route to these programs. Understand that you can do a community health major with a clinical science concentration. Health administration, the easiest way to describe, is the intersection of business and healthcare. This program prepares graduates to function as managers and clinicians in a variety of settings. And then with this program, you do have 3 options for concentration, but understand that you do have to choose a concentration with this program. You can choose assisted living senior housing concentration, and we are the first university in the U.S. to have a program in this field. We also have a health informatics concentration, which is the intersection of IT and healthcare. And then there's health systems management, which prepares graduates to serve in entry-level administrative and support positions in many health-related agencies and organizations. Social work. So social work program prepares students to improve the well-being of individuals, families, and communities, and the department focuses on assessing, planning, implementing, and evaluating programs at all levels, from the individual to the community, to affect social change. With the social work program, the biggest thing to know is usually the first 2 years you're focusing on your Mason core requirements and electives, and then when you get to your junior and senior year, that's when you're starting to really dive in deep with those social work classes. Also, students do participate in a supervised field practicum during their junior and senior year to supplement that classroom work, which will prepare students for a variety of career settings. And you can see those, the list are right in front of you. So we do have social workers in a multitude of settings. And then that brings us to nursing. This program prepares students to deliver superior nursing care and provide leadership in nursing in the increasingly complex and challenging field of modern health care. We do have a couple of different pathways into the nursing program. I'm sure most of you listening today are interested in the traditional nursing program. And that program specifically is for students that do not currently have a bachelor's degree and do not hold an RN license. We also have the accelerated second degree program, which is for students that already have a bachelor's degree that would like to get a second bachelor's degree in nursing. This particular program is only 1 year, so it's very, very fast, which is why we call it accelerated. We also have an accelerated veteran LPN to BSN. So if I have any veterans out there that have military health training background or have an LPN license, this is a quick way, 1 year, to get your BSN degree. So it's a really great program. We also have the RN to BSN and co-enrollment program, which they're the exact same program. The only difference is when you choose to start them. But this is if you opt to start with the Associate of Applied Science degree in nursing from a Partner Virginia community college. So you would start there with a nursing program and then come to Mason to complete the BSN side of things. For the clinical placements in the nursing program, it includes a multitude of healthcare settings in Northern Virginia and Washington, D.C., and we've already employed more than 7,000 graduates in those healthcare settings. So a little bit about the nursing program application. The biggest thing to know is that it is a second gate application. Typically, your first 2 years at Mason, you're focusing on the Mason core requirements, your nursing prerequisites, and your elective requirements. At the end of the fall semester of your sophomore year is when you start the application process for the nursing program. And if you are admitted, your last 2 years at Mason, your junior and senior year, will be nothing but nursing courses and program. You would be taking nothing else. Admissions decisions for this program are holistic and based on a variety of factors, including academic strength, communication skills, and experiences, mostly experiential learning. So we're looking at all of those different experiences that you have throughout college. The criteria for evaluation is completion of the nursing prereqs, Mason core, and elective courses, overall academic history and performance, nursing prerequisite GPA, an essay, and resume. I know I just grazed the top of the nursing program application, and I know you probably have a lot of different questions, but we do have a couple of nursing information events for you to consider if you do have more questions. So we have nursing information specifically. We typically do those throughout the year, and we do them in person and online, but obviously because of this pandemic, all of those will be online. If you go to our website, chhs.gmu.edu, you will see the full list of those nursing information sessions, so feel free to sign up for one of those, and you'll get the full list of eligibility guidelines and application requirements. We also do offer a nursing camp for students. It's for rising sophomore, juniors, and seniors. We typically do that in the summer. Obviously, once again, with this pandemic, everything is a little bit up in the air, so nothing has been finally decided about the nursing camp. So stay tuned to our website and social media to learn more about that. Also, we do have a nursing living learning community, or what we refer to as an LLC. It's for first-year pre-nursing students. It's an opportunity for you to live and study together. So essentially, you'd live in the same area of the Mason campus, and you'd also take a one-credit class during your first semester of your freshman year. It's called UNI 150, and it's usually taught by a nursing faculty member, so that's really exciting for you to go ahead and start out with the nursing program. If you are interested in the LLC, you can apply when you complete your housing application through the Housing and Residence Life office. We do take advising very seriously in the College of Health and Human Services. I know Maria can attest. Freshmen and transfer students will meet with their advisors during orientation to be advised for their first semester of enrollment. Once you are enrolled in the university, all students should initiate a meeting with their advisor at least once a semester, and that's extremely important to carry with you. Make sure you do that. We do offer holistic advising, which entails course selections each semester. We ensure degree completion, connect students with important Mason resources, educate students on Mason academic policies, receive personal academic and professional advising, and provide both in-person and online advising. So the university itself and, of course, the College of Health and Human Services definitely puts an emphasis on research. We are a Research One university in Virginia, and we have countless opportunities to work alongside preeminent faculty to explore their interests and develop critical research and analysis skills. Some of those different opportunities are listed in the screen in front of you, but I'm going to move on to the next slide to show you a couple of different things that are currently happening within our college where students are working with faculty members on their research. You can certainly read through those, but I will draw attention to the first one, which is the Mason Health Starts Here cohort study. We are currently researching students' mental and physical health experiences and perspectives and factors that may affect college success, so that's really exciting. But we are also talking about and doing all of these different studies currently on our campus. Experiential learning, obviously research is part of that too, but just so you know, we do partner with more than 400 agencies, NGOs, nonprofits, healthcare facilities, and corporations to provide all students with hands-on experience in their fields of study. The ones listed on the screen in front of you are just a small example of those. The first one is our Mason and Partners Clinics, which we refer to as the MAPS Clinics, which is a free clinic for uninsured community members, students. Students from many majors can participate and gain clinical experience with these MAPS clinics. And we do have 10 of those in and around Northern Virginia, and they do accept volunteers all the time, so it's a really great program. We are in a prime location, of course, so that once again, there are those countless opportunities to gain experience in a range of field and organizations. And if you are interested in study abroad, the ones listed on the screen in front of you are the ones specifically associated with the College of Health and Human Services. There are tons of different opportunities, definitely, but these are just a few related to our college. Studying HIV and AIDS in Botswana, maternal and child health in Peru, and zoonotic disease in Kenya, Mongolia, and Equatorial Guinea. This is just a highlight. We have scholarships. So if that's something that interests you, please follow up on our website, chhs.gmu.edu, to see the full list of scholarships. And these are just the general CHHS scholarships. We do have additional scholarships for you depending on what your specific major is. And certainly, we do want you to be involved on campus. We have over 400 clubs and organizations here at Mason. You can see that full list on mason360.gmu.edu. But the ones listed on your screen, we have a couple of student organizations associated with our college, the Student Nurses Association and the Social Work Student Association. And then there are other health-related Mason organizations, once again listed on your screen. And lastly, so we can get to the questions, stay connected with us. This is our web address one more time, chhs.gmu.edu. Follow up with those information sessions. So if you have more nursing questions, and I'm sure you do, please consider joining us for a nursing information session. Also next week, and we have 2 in May as well. I'm doing an overview. It's basically the same presentation, but not in 10 minutes. If you want more information, please join us for one of those CHHS information sessions.